Halo semuanya, suara saya kedengeran nggak?
Kedengeran.
Oke, sorry ya, mungkin kalian agak bingung loh, kok itu namanya Dinartia Sutami. Saya lagi pakai Zoom istri saya karena Zoom saya terdapat error, jadinya nggak dipakai, nggak bisa dipakai, sehingga untuk pertemuan kali ini saya minjem punya istri gitu ya, teman-teman ya, untuk menghindari kebingungan. Okay, anyway, is the share screen that I share to you visible for you? Can you see the pictures of my presentation?
I see, sir.
Okay, that's great, nice. Oke, ini dengan kelas S1 Keperawatan 7B level 2B ya, is that right? Is that your class? S1 Nursing 7B level 2B, betul?
Betul.
Okay, that's right. How many total students do you have in this class? Ada berapa total murid mahasiswa di kelas ini? Boleh di-chatkan di box-nya, Miss PJ-nya. Who is the person in charge of this class? Mbak Sohifah ya. Oke, Mbak Sohifah, can you hear me? Kedengeran nggak? Kedengeran ya. Coba diketikkan di chat box total mahasiswa yang ada di kelas ini. S1 Keperawatan 7B level 2B, right? Anyway, can you hear my voice well? Can you hear me well?
I hear your voice well, Mr.
Well, yeah, it's clear enough for you to hear. Is there any noise that you hear behind? Ada noise yang kedengeran nggak? Suara apa?
No, okay, it doesn't have anything.
Oh, it doesn't have any noise. Okay, so I think while waiting for the others to come, I would like to open this class for this morning. Okay. Assalamualaikum warahmatullahi wabarakatuh. Assalamualaikum warahmatullahi wabarakatuh. Nice to meet you, everybody. First of all, I would like to introduce myself. My name is Gusti Putra, and you can call me Gusti or you can call me Putra. And probably this is our first meeting ya. Ini pertemuan kali pertama kita ya, teman-teman ya. Betul ya? pertemuan pertama ya. Yes, dengan saya. Karena di first meeting-nya itu dengan Miss Galuh kan, dengan Miss Galuh. Dan ini adalah awal dari semester ganjil ya, semester 7. Kalian kan mulai semester ini sudah masuk ke semester 7, is that right? Cool ya. Okay, so before I start the class, I would like to give you some information about this subject, tentang mata kuliah ini. Oke, jadi teman-teman, apa nama mata kuliah ini ya, kalau boleh tahu? Coba, saya pengen tahu seberapa jauh kalian memahami mata kuliah ini. What is the name of the subject? Namanya apa teman-teman?
Mata kuliahnya.
Nursing, yes, because you come from nursing faculty, right? You come from nursing major. Jadi kalian kan soon to be a nurse ya, ketika kalian lulus nanti dan berusaha untuk mengejar profesi, kemungkinan besar profesi yang paling possible itu adalah menjadi perawat ya teman-teman ya, karena kan kalian ada di prodi S1 keperawatan. Jadi the purpose of this subject, tujuan daripada mata kuliah ini adalah untuk mengenalkan terminologi-terminologi yang terkait dengan dasar-dasar keilmuan keperawatan ya teman-teman ya, seperti mengenali alat-alat untuk anestesi ataupun alat-alat untuk menyuntik ataupun hal-hal medis yang lainnya ya. Kalian kan juga sudah belajar itu di mata kuliah lain ya teman-teman ya, yang kalian ampu ya, terutama yang di bidang profesional khusus nursing atau keperawatan. Akan tetapi this subject is specifically purposed for you to understand a bit more about the terminology of medicine and nursing in English. Jadi ada beberapa hal yang perlu kalian ketahui terkait dengan profesi keperawatan yang berhubungan dengan bahasa Inggris ya teman-teman ya. Karena kan kalian juga berkutat dengan bahasa-bahasa medis yang mana banyak sekali diadopsi dari bahasa Inggris ya teman-teman ya, is that right? Kayak seperti anestesi. Anestesi itu kan kata asalnya dari kata bahasa Inggris ya, anestesia. Kemudian apalagi injeksi dari kata injection dalam bahasa Inggris. Jadi walaupun ini pembelajaran bahasa Inggris, tapi pembelajaran bahasa Inggris ini lebih spesifik tujuannya ya teman-teman ya, terkait dengan mata kuliah kalian. Dan it's going to be useful, akan sangat berguna bagi kalian ketika kalian menempuh jenjang profesi dan karir sebagai perawat. Karena walaupun ini materinya adalah bahasa Inggris, tetapi sifatnya cukup praktikal ya teman-teman ya, cukup berkaitan dengan job desk ataupun tanggung jawab sebagai perawat. And last meeting with Miss Galuh, kalian masih ingat what have you learned guys? Apa sih yang kalian pelajari dengan Miss Galuh? Coba kalian bisa ketik jawabannya di chat box ya. Apa yang sudah kalian pelajari dan ketahui di pertemuan sebelumnya with Miss Galuh? I would like to know what you have learned in the previous meeting with Miss Galuh. Ini private, ketik apa saja kira-kira. Singkat aja, nggak usah panjang-panjang. Kalian udah belajar tentang apa aja? Oke, Giving injection. Okay, that's right. Thank you, Rafika, for answering the question. Betul sekali. Kemarin kita apa namanya belajar tentang prosedur bagaimana caranya memberikan injeksi ya atau suntikan kepada pasien. Which is itu sebenarnya sudah kalian pelajari teknisnya in detail dalam mata kuliah profesional kalian ya teman-teman ya. Cuman kita di sini fokus menggunakan bahasa Inggris sebagai medium of instruction supaya kalian juga bisa terbiasa dengan hal tersebut. Karena mengingat betapa cukup urgentnya bahasa Inggris dalam profesi kalian ya, because most of the scientific journal and then journal of medicine they use English as their medium of instruction. So today we are going to learn about the vocabulary, kosakata-kosakata yang berkaitan dengan injection. Oke. Coba I want to ask you, what is the main tool or the main equipment for you guys as a nurse to give injection? What is the tool for you to give injection? What is it? What is the name of the tool you use to give injection? Apa alat yang kalian pakai, alat yang utama yang kalian pakai to give an injection, to give a medicine to the patient by doing the injection? Kira-kira alat apa yang dipakai? Namanya apa? Dalam bahasa Indonesia namanya apa?
Suntikan, Mister.
Yes, that's right. Do you know what is the English of that?
Shrine.
Yes, we call it as a shrine. That's right. Okay. I'm going to show you some vocabulary related to what is it? To the giving injection. Equipments. Yeah, there are many equipments, right? It is not only shrines because the procedure is quite complex. Okay. What is it? Shrine. You can see there on the tip of the shrines, you have the, what is it? The needle, yeah? The needle is the sharp object for you to penetrate the skin, the layer of the skin, so it can go to the vein, yeah, to the blood vessel. Do you know blood vessel? What is blood vessel, guys? Pembuluh darah ya, blood vessel. Blood vessel. How do you write blood vessel? Yes. So to penetrate blood vessel and inject the medicine, we use syringe. How do you say it? Syringe. Syringe. Okay. Beside the needle here on the tip of it, which is sharp, we also have the measurement here in, is it in milliliter? This is in milliliter, right? This is the capacity of the liquid, the capacity of the liquid that you can give inside. My question is this needle reusable? My question is this needle reusable? Means that you can use it more than one time or no? Can you use the needle more than one time or no? Bisa nggak kalian pakai needle-nya, jarumnya? Can you use the needle more than one?
Yes.
No, yeah, it's only for one time because of the sterilization ya. Karena kan harus steril, right? We don't want a strange object to go inside our body. Kita nggak mau zat-zat asing ataupun benda-benda asing, baik itu virus, bakteri, dan lain-lain, masuk ke dalam tubuh ya teman-teman ya. So the needle here, the needle is non-reusable. Nah, what do you call it? Non-reusable. Non-reusable means that you can only use it one time only. After that, you have to toss it. You have to throw it. Next one. Next slide. What do we have in here? What do you say? What do you have here? Can you see it? We call this as an alcohol swab. Alcohol swab. This is an alcohol swab. What is the function of the alcohol swab? So you can swab the point of the patient body, titik dari tubuh pasien, the point of the patient body to clean the skin, right? To make it sterile. It's for the sterilization, right? Because it contains of alcohol, which has the property of anti-mikroba ya. Kan sifat alkohol kan anti mikroba ya. Jadi untuk membersihkan the surface of the skin ya. Permukaan kulit yang nantinya akan disuntik. Is that right? Okay. Next one. How many alcohol swab do you usually use for giving injection? How many? How many berarti ada berapa? How many alcohol swab do you usually use to give injection? Biasanya pakai berapa? How many? Oh, sorry. Suaranya putus-putus ya, guys. Jelas nggak? Suaranya jelas nggak sekarang?
Iya. No, okay.
Revika, suara saya jelas nih?
Yeah, Mr.
Okay. Sorry Rahma Melinda, mungkin your connection is not really good ya. Tapi so far dari awal suara saya kedengeran atau kadang ada momen-momen yang putus-putus.
Kadang putus-putus, Mr.
Oh, okay. I will take the lesson slowly ya. Saya akan sampaikan ini agak lebih slowly ya. Barangkali ada connection problem ya. Karena kan biasalah teknis kelas online seperti ini. Okay. So my question is, how many alcohol swab do you use for one giving injection?
One alcohol swab, Mr.
Okay, that's right. And the next one, what do we have? What do you call this? Latex-free gloves. Where do we wear this? On our hands, of course. Right hands and left hands. Is it important to wear this when we give injection to the patient? Why is it important? Yes, it is the reason, same with alcohol swab, right? To keep us sterilized. The purpose of wearing the gloves is to keep us sterilized. We want to avoid the risk of getting contamination. We want to avoid the risk of getting a contamination. That's why we wear latex-free gloves when we are doing the injection procedure. Next one. Okay, what do you see in here? Medication to be injection. This is the medication for us to inject using syringe. It is in form of liquid, yeah, liquid, yeah. This shape is liquid. If it is what is it? Solid material, usually it is oral. You know oral medicine. Yeah? You drink it, you take it with your mouth, and then you drink the water. But for the medication to be injected, usually the shape is liquid. So what is the procedure that we use to inject the medication? First, we need to use our syringe, right? And then we pull the trigger, pull the trigger until it fills with the correct dose. Sampai dosisnya tepat kan, berapa mili misalnya. We pull the trigger and then we inject, we pinch the skin of the patient and then we penetrate it with the sharp needle. Ditusuk ya, dimasukkan, dipenetrasi terus. We push it, push. So when we want to fill it with the medication, we pull the syringe, and then when we want to go inside, we push, pull and push, pull, pull and push. I just wrote the word, yeah, how to spell it. Pull means tarik, push means tekan. So when we want to inject the medication to go inside the human body through blood vessel, we pull and we push. We pull, we pull the medicine and then we push it inside. Next one. Okay, what is it? Sharp container. Why in the sharp container it is written biohazardous? Itu artinya apa biohazardous in Indonesia? Biohazard.
Sampah biologi.
Yes, that's right. Good job. So, what are the objects that we need to put inside this container? Objek-objek apa yang kita masukkan di tempat ini, teman-teman? In English ya. Benda-benda apa yang kita harus masukkan di tempat ini? Ketik jawabannya di kolom chat. Okay, you can type your answer in the chat box. I will give you 5 minutes. Okay, everyone ya, semuanya. Everyone needs to type the answer. What are the things that you need to put inside this container? Apa saja, benda-benda apa saja yang harus dimasukkan di wadah ini, container ini. Okay. Okay, I will be waiting for 5 minutes. Okay. Okay, it's already 5 minutes. Let me check your answer. Hand spoon, alcohol swab, shrines, latex-free gloves. Yes, those are the things that needs to go to this shop's container because it has already exposed by something which can be contaminated ya because the seal has already been open karena kan segelnya sudah di open dan those things are non reusable ya. What is non reusable guys? Nggak bisa dipakai lagi ya, only one use and then you throw it away. Medication to be injected, yes. Okay, that's great, nice. Okay, next one. I will move to the next slide. Okay. Patient's medical record. Okay. Wow, this is a very important document ya. Ini hubungannya dengan patient administration ya, administrasi dan pencatatan. Nah, I have a task for you. Saya punya instruksi buat teman-teman yaitu menuliskan data-data apa sajakah yang ada di dalam patient's medical record. Tapi you have to write the data in English ya. Kalian harus menulis nama datanya dalam bahasa Inggris. Misalnya apa data apa yang bisa kalian lihat di patient's medical record? Nama ya, otomatis nama pasiennya kan. The name of the patient itu salah satu contohnya. Nah, what is the other example? You have to find it. Kalian harus mencari contoh-contoh yang lainnya. Okay, guys. For that, I would like to give you 10 minutes ya. Saya akan kasih kalian 10 menit untuk menuliskan data-data apa sajakah. What are some the data that we can find in the medical record? Data-data apa saja sih yang bisa kita lihat di apa namanya catatan catatan medis seorang pasien ya. Okay, so starting from now we will start the discussion in 9:22 ya, di 10 menit kemudian. Okay, time is yours. Silahkan, please use your time in 10 minutes. Let's go. Okay, we still have 6. Okay, that's great. We have got some answer in here. First one is diagnostic test result. That's right. And then patient's identity, yeah, identitas, identity, ID, yeah, like DOB. Do you know DOB? Date of birth, tanggal lahir, and then also age, right? Umur, age, medical history, riwayat kesehatan, past medical history, and then admission diagnosis, complaint. Okay, complaint is like their health problem, yeah. Treatment checks, also next action plan, early symptoms. Okay, that's great. Okay, nice. Great job, everybody. Yep, so you can find a lot of important information inside the patient medical record. Banyak data-data penting ya yang terkait dengan uh, kondisi ataupun situasi dari pasien tersebut. Jadi, of course, you also bring this during the injection procedure ya. Selama prosedur penyuntikan pasti ada apa namanya catatan ya administrasinya. Okay, that's right. Next one, we will move to the next. What's it? Next vocabulary. Okay, what do you see here? Sterile, sterile, sterile needle, sterile. In Indonesia, we say it's sterile, but in English, we say it's sterile needle. Yep, it is the sharp of object that can penetrate the skin. Ya, benda tajam yang dapat menusuk skin surface. So the liquid of the medicine can go inside the blood vessel. Next one, we have what else? Oke, ada yang tahu cara membacanya gimana? Tourniquet, 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 tourniquet. What is the function of the tourniquet, guys? Fungsinya apa? What is the function of the tourniquet? Oh, we use it to tighten the blood vessel. Kita gunakan Turin hat itu untuk supaya tighten. Apa itu tighten artinya? Mengencangkan part of the body blood vessel. So it kelihatan ya, it's easier for us the nurse to make us easier to inject the medicine ya, karena kan the blood vessel is tightened in some part of the body ya, di bagian tertentu yang akan disuntikan kan dikencangkan dulu ya supaya bisa menonjol, to make it visible, menonjol, kelihatan. Okay. Next one, next vocabulary. What do we have here? Cotton balls. Cotton balls. Can anybody explain to me what is the function of the cotton ball? Untuk apa? To wipe. To wipe. To wipe the wound. Right. Ketika the needle is being injected kan lubang tubuh terbuka ya teman-teman ya, and the blood will leak, so we use it to wipe the wound, wipe, right? Cotton ball, what is it? Cotton ball. Is it important to use cotton ball? Yes, it is important, very important. Next one is the verb. Insert. Insert is when you step. Insert. Insert what? Insert berarti apa yang di-insert? Insert what? Insert shrine. Okay. Insert shrine. Next one. What is it? Release. 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 Melepaskan. Release. Release. Push down. Push down. Jadi tadi udah sempat gitu ya, teman-teman ya, kita bahas ya. When the syringe is penetrating the skin, the blood vessel, we need to push the trigger so the medicine can go inside the patient body. Jadi obatnya bisa masuk ya, go inside, masuk inside the patient body, tubuh pasien. And then also what else? Pull back. Pull back is the opposite of push. Kalau push kan didorong ya, push. Kalau ditarik, pull back. Okay. Next one. What is it? Inject. Inject is the action of putting the needle inside. Ya, ditusukkan. Inject itu artinya ditusukkan. Inject. What equipment do we inject inside the patient body? Apa alat yang dipakai untuk menginjek apa namanya? Syringe, that's right. Kalau yang kita push back itu apa? Syringe juga ya. Kalau yang kita pull back itu apa? Syringe juga. Swab. Kalau yang kita swab itu apa? Alcohol swab. Swab. Wipe. We can also say wipe. Wipe itu mengelap ya, mengoles, mengelap. Swipe is also okay. When you apply something on your skin surface, you can say swipe. And then withdraw. Withdraw is mengambil ya. Withdraw itu mengisi, kalau dalam konteks ini berarti mengisi shrines dengan apa? Dengan
Medicine.
medicine ya, mengisi shrines dengan medicine. Caranya gimana?
Pull back.
Pull back. Yes, you can withdraw the medicine with shrines by pulling back the trigger. Withdraw ya, mengambil. Secara makna withdraw itu artinya mengambil. Tetapi dalam konteks ini berarti menyedot ya, teman-teman. Kan disedot kan ke dalam suntikan itu. Nah, withdraw sendiri bisa dipakai dalam konteks lain. Misalnya mesin ATM ya, withdraw the money. Nah, kalau itu konteksnya withdraw-nya artinya apa? Withdraw the money in ATM. ATM. Mengambil ya. Mengambil uang. Jadi withdraw ada beberapa makna. Kalau di sini konteksnya adalah menyedot obatnya ke dalam shrines. The next one is pinch, dicubit ya. When we want to give injection, usually we pinch the area location, right? Di lokasi titik suntiknya kan. We pinch, cubit. We can say pinch as cubit. Next one, wash hand. Yes, we wash our hands after or before. After a procedure or before procedure. What time do we wash our hands when we are going to do injection? After or before?
After and before procedure.
After and before, yeah. After and before, because we have to keep ourselves in hygienic condition, right? We want to avoid contamination. Okay. So I will write some important words in here. Avoid contamination. Artinya apa tuh avoid contamination? Menghindari ya, mencegah kontaminasi. Next one. Nah, tadi kita udah sempat singgung nih kata ini. Artinya adalah tighten. Artinya adalah mengencangkan. Oke, tighten artinya mengencangkan. Kalau mengendurkan berarti artinya apa dalam bahasa Inggris? Kalau tighten kan mengencangkan. Kalau mengendurkan apa dalam bahasa Inggris? What do you tighten? Apa yang kalian kencangkan? What do you tighten? Benda apa? To recap ya. What do you loosen? To recap. Jadi
Mohon maaf, Mister, suaranya tidak terdengar.
sorry, forgot to unmute myself ya. Maaf, maaf. Sorry, lupa di unmute. Okay. Next one is put on, guys. Put on. Put on is when we put on something in our body ya. Ketika kita menempelkan sesuatu di tubuh kita. Misalnya, what is it? What do we put on in this picture? What do we put on in this picture? We put on the, what is it? What is it?
It's good.
Yes, that's right. It's a glove, latex glove. Yeah, the material is latex glove. Is disinfect. Disinfect is to clean. Yeah, is to clean something that may have infection risk. Untuk mengeliminasi resiko-resiko kena infeksi ya. So we can say disinfect. Kayaknya kalau kosakata ini cukup familiar ya di telinga teman-teman ya, karena sama juga dalam bahasa Indonesia juga kita menggunakan kata ini untuk disinfect. Oke, what are the equipments that we use to disinfect? Alat-alat apa saja yang kita pakai biasanya untuk mendisinfect sesuatu? What are the things? Yes, alcohol swab. That's right. Because alcohol is disinfectant, right? It can kill bacteria and germs. So yes. Okay. I think that's all for the vocabulary that we, what is it? That we can learn. Untuk sisa waktunya, kita akan selesai sampai pukul 10 ya teman-teman ya, 9.55 lah, pukul 9.55 berarti kita masih punya waktu berapa menit? 25 menit ya teman-teman ya, 25 menit. Setelah kalian mempelajari beberapa kosakata tersebut, saya minta teman-teman untuk menuliskan prosedur. I would like to ask you to write a procedure about giving injection ya. Jadi membuat teks prosedur ya. Urut-urutan tata cara dari awal sampai akhir, from the beginning till the end, ditulis di buku catatan atau kertas seperti ini ya teman-teman. Atau kertas seperti ini. Oke. Okay? Do you have it? Kalian punya kertas seperti ini?
Yes.
Yes. So you have to write the procedure text tentang bagaimana caranya memberikan injeksi dalam bahasa Inggris menggunakan kosakata yang sudah kalian dapatkan ya teman-teman ya di pertemuan ini. Nanti hasilnya bisa difoto dan dikirimkan melalui PJ-nya ya, teman-teman ya, melalui PJ-nya biar kita bisa lihat sejauh mana teman-teman bisa menggunakan bahasa Inggris untuk menjelaskan caranya memberikan suntikan atau injeksi gitu. Oke, cukup jelas ya teman-teman. Apa yang harus kalian lakukan? Membuat teks prosedur. Teks prosedur tentang apa? Urut-urutan tentang apa? Tentang memberikan suntikan. Jelas ya teman-teman ya. Oke. Alright. We will have our time until 9:55 ya. Jam 9.55. Nah, setelah kalian selesai, kalian bisa foto dengan kamera handphone. Sebisa mungkin cahayanya di itu ya, setting ya biar mudah untuk dibaca, kemudian dikirim ke PJ kalian. Oke, siapa PJ-nya? PJ-nya siapa? Sohifah ya, PJ-nya Sohifah betul ya? Yes. Oke, Mbak Sohifah ya. Oke. Oke, sebelum kita mengerjakan, boleh dinyalakan semuanya itunya, teman-teman. kameranya kita buat bukti ya teman-teman ya, bukti kehadiran, silahkan dinyalakan kameranya. Oke, terima kasih banyak. Kita kasih waktu 5 menit ya untuk menyalakan semua kamera sehingga pertemuan kali ini kita ada buktinya untuk pertanggungjawaban ya teman-teman ya, bahwa teman-teman menghadiri perkuliahan dengan baik dari awal sampai akhirnya. Oke, lintang-lintang dan oke, good semuanya. Oke, Wulansari ada ya? Oke, siap. Oke, kita hitung 1, 2, 3. Oke, thank you. Oh, Lintang tuh itu ya, cowok ya? Kirain cewek ya? Oke, siap. Thank you, Lintang. Silahkan dilanjutkan tugasnya. Disuruh mengerjakan apa, teman-teman? Membuat teks prosedur simple aja ya, simple, nggak perlu terlalu detail ya. Karena kan ini bukan mata kuliah kesehatan langsung ya, tapi mata kuliah bahasa Inggris, tapi tetap berhubungan dengan profesi kalian sebagai perawat gitu. Jadi harus bahasanya harus sesuai ya. Oke, thank you. Thank you, and you can continue your task ya. Kalian bisa meneruskan tugasnya. Oke, dan juga satu informasi lagi ya teman-teman ya, kalau kalian sudah selesai di menit ke-55, kalian boleh meninggalkan kelas ini ya teman-teman ya. Tapi in the meantime, kalian tetap di kelas, oke, untuk menyelesaikan tugasnya.